If turmeric keeps showing up as an inflammation cure-all, start with the awkward physiology. Curcumin, the yellow curcuminoid people usually mean, is poorly absorbed when swallowed alone, then metabolized and cleared quickly. That means a spoon of kitchen spice and a concentrated capsule are not interchangeable exposures, even when the marketing language sounds identical. The useful question is never turmeric in the abstract. It is which exposure reached the bloodstream, and whether that exposure matches any clinical trial people are quoting online.
So when those popular videos put turmeric next to pain pills, are they talking about curry powder in food, or a concentrated curcumin capsule that already includes an absorption trick like piperine or a fancy delivery system?
Nxai notes turmeric's long traditional use, and today oral products are promoted for osteoarthritis and many other aims. Curcumin can interact with inflammatory signaling in laboratory and clinical research, which is genuinely interesting biology. Still, mechanism is a beginning, not a verdict. Bioavailability is the filter between pathway talk and symptoms people can feel in a joint or see on a metabolic panel. Without that filter, every yellow capsule gets oversold as medicine-grade proof. I sort turmeric products into 3 exposures. Culinary turmeric is a food spice dose. A plain curcumin capsule is higher milligrams but still constrained by absorption. A boosted formula, piperine or another delivery system, can raise blood levels substantially, and that is where possible benefit and interaction risk both climb. If a label brags about absorption, read that as higher pharmacology, not as automatic safety or automatic clinical benefit. The same plant name on 3 bottles can hide 3 different products in real life.
If the boosted form is what actually gets into the bloodstream, does that mean the useful joint pain studies are mostly on engineered curcumin products rather than turmeric tea, golden milk, or a pinch in dinner?
Joint discomfort is the most practical benefit people search. Inflammation claims only earn weight when they map to a named condition and a measured outcome, not a vague anti-inflammatory halo. Osteoarthritis-oriented research is why curcumin stays interesting, but expect modest symptom shifts and messy comparisons across formulations rather than ibuprofen-level certainty. Digestive wellness or liver slogans are separate claims and need their own outcome data before they hitch a ride on the joint story. Here is the caution that belongs beside absorption marketing. Piperine can change medication exposure, so a bioavailability booster is not a free upgrade. If someone is on prescription drugs, especially medicines with narrow safety windows, treating a boosted curcumin product like ordinary food turmeric is the wrong mental model. That is the moment to involve a clinician before the bottle becomes daily habit, even if the capsule looks natural and plant-based.
Okay, leave the spice rack alone and look at capsules. Are the metabolic claims, body weight, waistline, lipids, actually stronger than the joint story, or mostly newer pooled abstracts with modest averages that sound bigger on thumbnails?
A systematic review of 9 randomized trials in adults with type 2 diabetes linked curcumin supplementation to average reductions of about 1.65 kilograms in weight, 0.69 in BMI, and roughly 0.9 centimeters in waist circumference. Subgroups looked stronger above 1,000 milligrams a day. Those are real pooled signals, not nothing. Yet the authors still asked for higher quality long-term trials before calling the changes clinically decisive for routine diabetes care, waist targeting, or weight management alone. In people with prediabetes or diabetes, another meta-analysis found modest drops in triglycerides, total cholesterol, and LDL, plus a small HDL rise. Certainty was graded low, heterogeneity was high, and apolipoproteins did not move clearly. One longer randomized trial also reported inflammatory marker improvements with 1,500 milligrams a day over months, but that still does not make curcumin a replacement for proven lipid-lowering or diabetes therapy on its own.
Those diabetes averages sound tempting on a label. Before someone stacks a gram-plus curcumin product on blood thinners, gallbladder disease, pregnancy plans, liver concerns, or a pre-surgery checklist, which boundaries should stop this self-experiment cold?
Other endpoints are quieter than the ads. Homocysteine-lowering evidence is currently non-significant with very low certainty, so curcumin should not be sold as a standalone homocysteine fix. Exercise recovery reviews see some oxidative stress signals, but muscle damage, inflammation, soreness, and performance findings stay inconsistent across sport settings. Memory-related results from zingiber products look domain-specific and still very uncertain for everyday brain claims people hope for after watching supplement videos.
If I am shopping this weekend, how do I tell whether a bottle is even designed for the kind of exposure those diabetes and joint trials used, instead of just dyeing my smoothie yellow?
Read the label as a pharmacology note, not a recipe card. High-dose extract is not turmeric in food. Dietary supplements are not FDA-approved drugs for treating disease, so influencer dosing charts do not replace a clinician who knows your medicines, gallbladder history, pregnancy status, and liver labs. Proportional caution beats either fear-mongering or blind enthusiasm about a golden kitchen spice. Judge help with a concrete target. Morning knee stiffness, a pain score you already track, or labs your clinician owns, not a vague sense of less inflammation. Keep the same product and dose for a defined window, often around 8 to 12 weeks if you and your clinician agree to trial it carefully. Stop for digestive distress, unexpected bruising, or liver-related symptoms rather than escalating the dose to chase a feeling or switching brands every paycheck. No target means no honest way to know whether it helped.
So the fair takeaway is mixed evidence with a bioavailability asterisk, possibly useful in some joint or metabolic contexts, useless as a universal inflammation eraser, and the absorption booster has to sit inside the risk math with your medicines and surgery plans, right?